I had the pleasure, of course, Dr. Gordon, to, I believe, meet you in Bangkok on occasion, and you were involved in a very, very interesting program that was unique to Thailand at that time. Perifica, I believe, was the name of this local plant. Why were you there, and why was that all so special?
Well, as I am a doctor involved in anti-aging, and as my FIGHT program includes food and focus on infection and heavy metals and hormones, I needed an answer for men and women to deal with a little thing that is our estrogen needs. Estrogen turns out to be a really powerful growth factor. That's why everybody's so afraid of it, because they think it's going to turn on the growth of cancer.
Right.
And here I found the growth factor that actually is so smart, it makes the cancers not grow. And so I can have my cake and eat it too. I have been able to find a way to let a woman have no more hot flashes, no more bone loss, no more insomnia, depression, no more vaginal dryness. And I, as a man, take it because I found the men in northern Thailand where we came upon this. It was because they had the lowest incidence of breast cancer. So we thought, what are these guys eating up here that's getting them protected?
Right.
And we found out that Pueraria mirifica, which is kind of a gourd-like structure, when you pick it on the right day of the year, when the flower changes color,
Right.
and then you take that big gourd and you find it with a large company in America that can standardize the active factor that we needed. Now you have the big term, a selective estrogen receptor modulator of the beta receptor. Big words,
Yes.
but important words, because receptors are where all the action is at.
Right.
So now I could have my cake and eat it too. And we've done very good studies with Margaret Ritchie, one of the world's authority on estrogen receptors, and she's ecstatic about what this is doing. And we've been able to convince ourselves with research that I meet with the Thailand Research Council, because we know that this is so big that it needs to be, frankly, part of every woman's anti-aging program. And we didn't want to build a lot of interest in something that we didn't have the research behind it. So we worked with MD PhDs at the Army Hospital in Thailand. We needed to be sure that this would actually provably take cell cultures that are the breast cancers that women have, and would this actually do as much as tamoxifen, and it did. So here's something that competes with the drug effect that women are taking, which wrecks their lives.
Yes.
And here we were getting the same benefit, but it doesn't wreck their life, it builds their life.
Yes.
So they can be sexually active at age 70 without having painful intercourse and dry vagina. So it was astonishing that in this one product, and because it's been in the diet for so long, we don't feel that we have to put women through a lot of extensive testing, because the safety had been well established by the epidemiological studies that we have done. So in one product, I have a key factor that I, as a man, am taking, because those men aren't getting up at night to urinate, so it's clearly helping the prostate and the bone. But across the board, it also can even protect a man that is choosing to use testosterone as part of his therapy, because it is going to prevent some of the aromatization of testosterone, which men often wind up taking, and that doesn't let it then dump and become estrogen and give a man who wants to be a man suddenly having breasts. So here I have something that is good for women and men. I like it taken with progesterone. And if the woman is still cycling and having menses, I have her take it off the week that she has a period.
Thank you, Dr. Gordon. That's fascinating. And I know you gave it an amazing name. I know you call it HRT Plus.
Herbal remedy from Thailand.
Great name. Great product. Thank you.